My name is Yara Alsher, and I serve as the Executive Fellow in Education here at APHA, and I'm very excited to be the host for today's episode. Today, we'll be exploring how pharmacists can support early risk identification for complications like gestational diabetes and hypertension, improve patient understanding of maternal health guidance through effective communication, and build collaborative care models that increase access to services in underserved communities. With me today is a mentor and someone I've long looked up to, Trisha LaPointe, a clinical pharmacist and dedicated advocate for women's health. In part one of the series, we explored the WHO 2024 maternal health recommendations from physical activity to symptom management, so be sure to check that out. Today, in part two, we'll shift our focus to pharmacist led interventions that close maternal health gaps with a spotlight on early screening, health literacy, and system level collaboration across care settings. Trisha, welcome. To start off, could you please introduce yourself to our listeners and share a bit about your role and responsibilities?
Hi, good morning. Thank you. Yes, my name is Trisha LaPointe, and I have been a faculty member at Massachusetts College of Pharmacy and Health Sciences for a little over 20 years. Majority of my practice has been inpatient general medicine, where I'm currently practicing and taking pharmacy students who are doing their API rotations at Lowell General Hospital.
Thank you. Let's begin with key public health opportunity, early risk screening in pregnancy. Trisha, how can pharmacists help identify patients at risk for complications like gestational diabetes or hypertension, ensure they're referred appropriately?
Thank you. That's a great question. And I think, particularly in some of the unique settings that pharmacists are able to practice in, like ambulatory care clinics, and also, the pharmacists that are out working in the community, I think can be a great resource for patients just because they have easy access to those patient populations. And medication management can is a big thing out in the AmCare and community. So helping patients to really understand their medications, especially when we talk about pregnant patients and the safety of those medications. Pharmacists are involved a lot with screenings as well, like you mentioned, high blood pressure. And I think just being the resource for them to make sure that you're encouraging patients to receive maternal care throughout their pregnancy, because there are significant milestones throughout pregnancy, and one of them being around that 22nd week of pregnancy where they do gestational diabetes screening. And I know you mentioned the World Health Organization and how they have specific, suggestions or guidelines for what antenatal care looks like. And that includes, having at least 8 visits, having an ultrasound focusing on nutrition, and also the mental health aspect.
Thank you for sharing that. So let's now talk about health literacy and communication. I know pharmacists are one of the most accessible healthcare providers, as you just mentioned. So, what are some effective strategies for helping pregnant patients understand the WHO recommendation, especially when there's language or literacy barriers?
Yeah, sure. So that obviously is a big concern. So I think pharmacists being aware of cultural competency, so really understanding, where the patient is, what their norms, what their practices are. The other thing too is, sometimes where some of us may be more visual type learners, understanding things. So usually using visual props and things like that to help patients, whether that be like a chart or a diagram or even like a picture of what might be going on during their pregnancy at that point. Other things is using, simple language. So staying away from, the medical jargon. Sometimes not only do patients not understand that, I think sometimes it might be intimidating as well. Like, well, what's happening to what's gestation? The lay public doesn't really understand those words. I think there's a big space here for technology and health apps. Um, Obviously, when you're just talking about a language barrier, there's a lot of apps that you can use for translation. Other medical apps that might be available too might have language preferences within them. And I think that these are helpful for patients because it really allows the patient to engage in their care, whether it's, setting up reminders or, understanding where they are in their pregnancy and the development and what's going on. Nutrition is huge. So getting any kind of support you might have for those, particularly when we talk about folic acid supplementation. Um, and then, if it is strictly just a language barrier, utilizing any kind of interpreter services or technology to help with that.
That's a great perspective, especially when incorporating technology and apps. And finally, another area we're seeing grow is interdisciplinary collaboration. So, can you share some examples of successful pharmacist provider partnerships in maternal care, whether through clinics, community settings, or even like telehealth?
Sure, yeah. So, like I mentioned earlier, there are pharmacists that are actually out practicing in the ambulatory care clinic. So, I think that in itself lends a lot of collaboration because you're kind of working all in the same facility together. But I think too, like, even out in the community, there is a connect, with the providers and helping get patients the best care possible. And I think when you mentioned about hypertension, I think that's a key way because we have the ability as pharmacists to be able to assess someone's blood pressure pretty easily, whether it's in the community or ambulatory care setting. But I think one of the ways we've seen maybe some collaboration is when we talk about preeclampsia and the U.S. Preventive Health Service has a recommendation out there to use low dose aspirin, 81 milligrams, in the patient population that's at risk. So I think pharmacists can play a role kind of identifying who those patients might be. Do they already have hypertension prior to pregnancy? Is the obesity? Are they an older age for pregnancy? And then making that recommendation. And I think there's a lot of confusion out there when you see pregnant women being prescribed aspirin and kind of seems like something we shouldn't be doing. But actually, it has been shown to be helpful in patients that are at risk for preeclampsia. So I think having that collaboration between, providers and pharmacy and the patient, that's probably a good example of how that might work out.
Oh, awesome. Thank you. That's very helpful. And we did try to highlight in the first episode about pharmacists' role in preventions of hypertensive disorder. So thank you so much, Trisha. And thank you for joining us today and sharing your expertise. This has been a thoughtful and inspiring look at how pharmacists can lead in improving outcomes in maternal and women's health. So let's summarize major takeaways from our time here today. Pharmacists play a vital role in maternal health by identifying early pregnancy risk, bridging health literacy gaps, and collaborating across care teams to ensure timely patient-centered intervention. All right, folks, that's all for today's episode of The First Fill. If you missed last week's episode, we explored the WHO 2024 maternal health recommendations from physical activity to symptom management, so be sure to check that out. And as always, don't forget to visit the Learning Library at pharmacist.com to earn CE credit for this month's podcast. We'd love to hear your feedback on the new format. Take care, and thanks for listening.